I'm the dean of the Texas Tech School of Medicine, and I've been the dean for 15 years, so I'm one of the longest serving deans in the country. And passion, I feel the responsibility on my shoulders for producing the best possible physicians in all specialties for this community and for West Texas as a whole. I had been in very good health. I exercised with an elliptical about 45 minutes a day, never had any chest pain, kind of ideal body weight. I had no history of coronary artery disease in my family. And on December 10th, here in this office, I was actually giving a Zoom lecture. And then at 1:10, I developed severe chest pain. And being a well-trained physician and seeing lots of coronary artery disease at Boston City Hospital where I trained, knowing how to evaluate chest pain that's coronary artery disease from other types of chest pain, this was it. This was a heart attack. There wasn't any doubt about it in my mind. And I asked Charity to get a wheelchair and wheel me down to the emergency room. I actually wrote an email to my two boys saying, love you boys, because I knew this was going to be trouble. We got down there, they did a quick troponin, which is a chemical test for a heart attack, and it was positive. They took me to the cath lab really quickly. Dr. Shermer took the lead on that, and to everybody's great surprise, I had a 5-vessel blockage. I didn't know there were 5 vessels. I thought there was only 4 vessels, but I had 5 vessels blocked. They called Dr. Paoni right away, and I had emergency 5-vessel bypass surgery. It was actually a rocky course. I was in the CCU for 7 days. There was the issue of my kidneys not working well after the surgery, questions of dialysis. My respiratory status was sort of marginal. So it was a very tough several days in the cardiac care unit. I was very fortunate to know that Dr. Paoni has a reputation as one of the best cardiovascular surgeons in the country. Dr. Shermer and the cardiologist did a great job. They're my cardiologists. I hired them all and had total faith in them. But when all was said and done, I had very little heart damage. My cardiac ejection fraction, 54%, is actually normal. I do cardiac rehab now, and that's worked out great. So I recognize the quality of UMC. Our medical students in a national survey have rated UMC at the very top of the country. We have great residency programs that usually receive commendation for accreditation. So I knew they did a good job, but for me, they did an amazing job. So I'm in very, very good shape. I'm back to being dean full-time. I come in at 7, I leave often at 6. My energy level is excellent. And I guess it's pretty clear that under a lot of other circumstances, you can't really survive with 5 blocked arteries. So I'm grateful for all of the care that I received.